Let's talk about the Massachusetts male aging study. Now, this is the biggest publication in men's health ever, essentially. This was a study that was conducted by a group of Harvard researchers, started in 1987. They enrolled 17,000 men from the Boston area that were aged 40 to 70 years old, and basically asked them a series of questionnaires and did a series of tests on them, and then followed these men longitudinally over time. The study's actually ongoing, and we're looking forward to seeing what the latest publications show. But the last big publication on this was in 2004, and there's a ton of findings from this. Basically gives us a roadmap of what aging in men looks like, at least from a population level. But to summarize, one of the biggest findings was the prevalence of erectile dysfunction, where over half of the men aged 40 to 70 years old had some degree of erectile dysfunction. Obviously, most of those men were not receiving treatment. Now, if you look a little bit closer and you ask how many of those men had complete erectile dysfunction, meaning no erectile function whatsoever, it was about 10%, which is still very significant. 10% of men in that age group, 40 to 70 years old, had no erectile function whatsoever. And if you look longitudinally, the rate of complete erectile dysfunction from a 40-year-old would be 5%, and in a 70-year-old would be 15%. So this is really the age range where this complete erectile dysfunction triples. And using all of the data from the study, we're able to see what are the risk factors, or at least the correlates, with erectile dysfunction. And it's not surprising to see high blood pressure, diabetes, tobacco use, obviously age as the biggest risk factors, because those are the things that cause vascular disease. Also, not surprisingly, erectile dysfunction was very strongly correlated with cardiovascular disease, heart disease essentially. And it's because these things all are related to microvascular disease, or small blood vessel disease. If you have small blood vessel disease in the penis, you likely have small blood vessel disease in the heart. And interestingly, if you look at the men who did not have any cardiovascular disease at the beginning of the study, and you see which one of those men had erectile dysfunction and which ones did not, the men who had erectile dysfunction were much more likely to develop cardiovascular disease in the future, which tells us that erectile dysfunction can actually be the first sign of cardiovascular disease. So if you're a patient who has no history of cardiovascular disease, but you do have some erectile dysfunction, that may be a warning signal. Yes, get your erectile dysfunction treated, but also make sure you're doing all the other stuff right, controlling your blood pressure, diabetes, tobacco exposure, anything else that you can do to help lower your risk of heart disease, because obviously that's much more serious. Another interesting finding from the study was the correlation between erectile dysfunction and depression. It's hard to tell which causes which. Obviously, not being able to have erections can be very depressing for a lot of men, and it's also possible that depression itself can independently cause erectile dysfunction. Probably both of these are true. So this study really provides a roadmap for us working in men's health, and it's something that your urologist should know about, and something that you can ask about to know where you stand and what you should expect in the future.